Good afternoon, everyone, and thank you for joining for this media briefing. I am Lisa Lord, and we do apologize for the late start. We will be addressed by the Minister of Health and Wellness, Lieutenant Colonel the Honorable Jeffrey Bostic, the Chief Medical Officer, Dr. Kenneth George, now the Acting Chief Education Officer, Ms. Joy Adamson, and the President of the Barbados Secondary Teachers Union, Ms. Mary Ann Redmond, are also present, but Ms. Redmond will not be taking questions this afternoon. Now, the Minister of Education, Technological and Vocational Training, the Honorable Santia Bradshaw, will address the members of the media over the weekend. And we will start first with Dr. George.
Thank you so much for giving me the opportunity to make a brief statement. I will start with what are the current information that we have from yesterday's count. There were 733 tests done. 14 of those tests were positive. 6 were male, 8 were female. And of the 14 cases, 4 were from the psychiatric hospital. And we continue to do that investigation. To date, at the psychiatric hospital, we have had a total of 50 cases positive, 49 males and 1 female, and of that 50, we have 2 staff members who tested positive. So that is the latest information that we have as to the statistics that occurred yesterday. I will follow this by a brief statement. The Ministry of Health and Wellness is investigating exposures at 2 schools, the St. George Primary School and the Prince Margaret Secondary School. These cases, or the cases in these schools, have been linked to 2 extended family clusters. The student at St. George Primary School was tested and the first test was negative. We are awaiting to perform a second test as early as the 8th of May. The students at that school are doing homeschooling, online schooling, and the Ministry of Education has been very cooperative in sharing the lists of students and teachers at that school. If needs be, we will certainly institute much more contact tracing at this point. With respect to Princess Margaret School, there was a single exposure involving a student from the 5 upper 1 and 5 upper 2. And based on that information, we have identified a total of 58 contacts. 2 of those contacts are what we describe as very close contacts. And those persons are in quarantine and they will be tested today. The plan is to test all students in the upper 1 and upper 2 classes. And in addition to that, a list of teachers were provided by the school so that we have a complete picture as to where we are at the school. These cases are linked. As I said, there are 2 families, 2 extended families, which we continue to look at. And in that family group, we have identified several persons who have been positive, and those persons are being managed at Harrison's Point. So that is where we are with respect to the coverage of the schools in Barbados. Let me remind the public that we continue to investigate the psychiatric hospital. As I indicated, there are 50 individuals. Yesterday afternoon, we indicated to the public of Barbados that this was confined to a ward. But now there is 1 single case that has popped up on another ward. And what we have done is we have found 30 staff members across the whole plant who believe that they may have been exposed in some way, and we made a decision this afternoon that all those individuals will be placed in quarantine at a hotel in Barbados. So therefore, we continue to work with the psychiatric hospital to make sure that the issues there remain contained. At this point in time, the outbreak seems to be mainly with clients and only a few staff members. And in closing, I will just let the public know that there has been some reluctance on the part of some members of staff at the psychiatric hospital not to test. And I'm just imploring you that if we are to get to the true bottom of the situation in psychiatric hospital, we need the cooperation of all staff. Thank you so much.
Thank you very much, Dr. George. We go now to Minister Bostic.
Thank you, Lisa. Thank you, Dr. George. Good evening, everyone. Dr. George would have given you an overview in relation to the results we would have received this morning, resulting from testing that would have been conducted yesterday and overnight at the Best Dos Santos Public Health Laboratory. What is important coming from those statistics is that the positivity average for today was just above 2%, which is still trending in the direction that we would want it to be trending. Of importance here, though, is the situation in relation to the two schools that were referred to by Dr. George. And I am here because I think it is important for me to put this in perspective. At this point in time, we do not have a problem at the two schools, even though we have concerns. One positive case, and the fact that this is really a family cluster that we're dealing with, which has spread its wings into these two schools. This was a similar situation that we had several months ago when we had another family cluster that ended up at the Ellerslie Secondary School. We've taken all the public health measures that we can take at this point in time, and based on the experience that we would have had with dealing with the situation at Ellerslie, we are applying that experience to this situation, and we are confident that we will be able to deal effectively with the situation at these schools. Now, in relation to the Princess Margaret Secondary School with the positive case, we would have started the process of contact tracing as indicated by the Chief Medical Officer. We would have tested a number of persons. We also did the same at the primary school at St. George in terms of at least getting ourselves ready for contact tracing if that situation develops. But remember that the student there tested negative on first test and is awaiting the second test in a few days. That student is in quarantine. We are satisfied that the Ministry of Education has taken the right decisions in relation to suspending some of the two classes at Princess Margaret that would have been impacted by the positive case, suspending face-to-face classes, that is, going back to online classes for the time being. And we will be watching this situation very closely to see if we pick up any additional cases at the school after doing and completing the second test. 3 teachers at the school should have been tested by now. I know 2 were before I left cabinet, and these are teachers that we felt were exposed given the proximity to students and so on, and to the positive case. But we are satisfied that as long as the protocols that are being held within the schools, once they are adhered to, that persons should be okay. We have also decided to make testing available on Saturday for any member of staff of the Princess Margaret School who, because they may feel uneasy, would want to be tested, and we're doing that out of an abundance of caution as we normally do. So the major point here is that we do not have an outbreak at the Princess Margaret Secondary School, at least at this point in time. We will follow the science and do the necessary testing, and by the time we finish with the testing, then we will know exactly what is going on. We're also continuing with the contact tracing of this family cluster to ensure that we contain it as well within the communities where members of family reside. This is part of the course. We've been dealing with it all along. COVID is here. We have to deal with it. We have to live with it. It is not a situation that is going to make us reverse any of the decisions that would have been made in relation to the easing of restrictions, because we are comfortable that this is not going to be one of those cases at this point in time. Similarly, we did the same thing with the Queen Elizabeth Hospital, and we've done the same with the psychiatric hospital, because these have been isolated and restricted clusters that we've been able to get on top of. We will continue to monitor the situation. We have advised the Ministry of Education that at this time there's no need to take further action. We've had a meeting a few minutes ago, where we have had members, representatives of the teachers' unions in Barbados, as well as Ministry of Education. And we are satisfied that based on the discussions that we've had, that there's some areas that were identified by the unions that we believe we can certainly try to assist the schools and the Ministry of Education with improving. We understand clearly that there will be anxieties, there will be concerns, and even fears by members of staff and parents. But we want to assure you that at this point in time, there's absolutely no need to panic, and that we will continue in the same mode that we've been going for the last few weeks. And if anything goes against what we are anticipating, then we would be prepared to take any further action that is required. But at this point in time, there is no need for any additional measures or actions at the schools, or certainly in the country. I would take this opportunity to just urge everyone, parents, teachers, students, the entire country, that taking the vaccine and allowing us to be able to reach herd immunity, that is the ultimate of the public health measures that we have introduced in this country, starting with hand sanitizing and wearing a mask and physical distancing and so on. But that is the one measure that will give us a level of sustainability in what we're doing, to be able to allow us to continue to reopen and continue to have economic activity going again, continue to get persons back to work. And all of these things are very, very important, because we also have to look at the psychosocial issues that things like lockdowns all over the globe have caused, and we've seen some impacts in Barbados as well. And that is why we want to try as much as we can to get back to a state of normalcy that would allow us to be able to do the things that we need to do to stop people from remaining at home all the time, not working, and so on. So that is what I wanted to say to the media and to the country. And I am prepared here with the Chief Medical Officer to take some questions from the press, so that if you have any doubts or queries, now is the time, and we will try to answer as best we possibly can. Thank you, Lisa.
Thank you, Minister. And as you said, we open for questions. Joining us from the media are Akil Lovell, Starcom Network, Colville Malmsey, The Nation newspaper, Kerry Gooden from Loop, Trevor Thorpe, CBC, and Randy Bennett from Barbados Today. Your questions?
Hi, good afternoon to the panel. Minister, this is a question for you, or the Chief Education Officer. Could you elaborate for me on the concerns raised by the unions in terms of the measures that they deem necessary to be tightened?
I can do so. The unions would have raised some issues, for example, in relation to transportation, buses, the transportation of students and so on. And there were some issues that we have identified ourselves within the Ministry of Health and Wellness. And some months ago, when schools were doing face-to-face, I would have seen some situations of concern to me, and I would have spoken to members of staff at the ministry so that we could try to deal with these situations. For example, we were satisfied in the ministry that the COVID protocols within the schools, if followed, will keep students and staff safe. The problem, though, is after school and the congregating of persons and students at bus stops in large numbers, not observing physical distancing, and in some cases, not wearing a mask. Those are the kind of issues that could cause us to end up in trouble. And those kind of issues were raised by the unions, and we have taken those on board because we agree. And that is why, as I would have indicated at the meeting, that the Prime Minister had given a directive to the Ministry of Health and Wellness for us to be able to deploy more community health liaison officers from the COVID monitoring unit to schools, and especially areas where there's a known heavy congregation of students after school awaiting public transport. And we are looking at it in the same way, for example, that we had put a special unit within the monitoring unit together to deal with the hotels and the hospitality industry, that this is something that we are doing in relation also to the schools, and we will work in collaboration with the Ministry of Education, principals of secondary and primary schools, and so on. So those kind of issues were raised, and we have agreed, and we will take those on board.
Good afternoon, panel. Good afternoon, Mr. Minister. You said that it's no need to panic, but St. George Primary and Princess Margaret Secondary, a primary school and a secondary school, do you think there's been a glitch somewhere because the school population in Barbados is kind of big?
And first of all, there's no positive case at the St. George Primary School. There's none. There's a student from the St. George Primary School who is a primary and close and family contact of 2 positive cases. And that is the connection, that is the link. But that student is in quarantine and has tested negative on the first test. And the student is awaiting now the second test before we can determine exactly what is going to happen there. But what you are seeing is part of the daily life with COVID. In other words, we can have all of the protocols in schools, we can have all the protocols in business places, in government, in institutions, but at the end of the day, people go back to homes, to communities, to their own daily way of life. And this is where COVID is. COVID is in communities. We do not see that we have it in several communities in Barbados at the moment, but as long as COVID is around, it will enter into institutions if we do not enforce or practice the same protocols that are called for in institutions, if we don't do that in our homes, if we don't do that in our communities. And that is the issue. So there's no issue within the schools to that extent.
The chief medical officer would have, and I'm hoping that I am quoting him correctly, that for the student at Princess Margaret, there were 50 close contacts. Could you give me an idea as the time frame as to over which those contacts were made with that student? And is this worrying within a context where there's supposed to be strict protocols? How was this student able to, within a classroom that's supposed to be socially distanced, spaced, etc., have 50 close contacts in whatever time frame that you can tell me there?
May be allowed to speak. We had identified, actually it's 58. Those were, so you got it wrong, it was 58. And these were persons who would have been in the classroom while that individual was in a classroom. Of that 58, we have identified 2 individuals who are of special interest to the Ministry of Health. Those 2 individuals are in quarantine. Those 2 individuals were tested today. And based on our contact tracing, if we have to test the majority of that 58, we will do it. So that it is just a process of elimination and narrowing down those who would have been most close to this individual while she was at school for the couple hours that she was on the plant.
If I may add, let me, I think I need to explain that a bit more. The 58 students are from two classes, two classrooms, persons who happen to be at school at that point in time. If you would recall, the Minister of Health happened to be at the airport to meet the Ghanaian nurses when they arrived, following all the protocols, wearing my mask, social distance and everything. Didn't have any contact, but I happened to be there within a space, and I myself went into quarantine and I was tested. I was absolutely certain in my mind that I was okay, but the protocol called for me to do that. And this is a similar situation. So it's not that these students were that close, that they were simply sitting at their desks, following the protocols, but they happen to be in the space, so that is the exposure. And we consider that to be honest with you, in a lot of cases, to have been limited exposure. But we still have to follow the science and do what is required. That is why, yes.
Good evening, Q-Level Starcom Network News. My question is directed to the Health Minister. Teacher unions had expressed concern about resuming face-to-face classes at this time, especially given that the country has community spread. Given these developments in just the first 4 days of the resumption of face-to-face classes, would you say that authorities can ensure that classes on compound can continue efficiently for this term with minimal disruption?
First of all, Barbados declared months ago that we had community spread, and I accept that. But I can tell you that maybe a month, 6 weeks ago, there was consideration for the reopening of schools, face-to-face school that is. And at that time, the Ministry of Health and Wellness advised against that. And why? Because when we looked at our map, we were still seeing cases springing up in several communities around the country. And for us, that would have been taking a risk that we did not think at the time would have been a manageable risk. However, at this point in time, we have a situation where our positivity average for the last 2 weeks, and I know we had a little spike 2 days now, well, yesterday, but the positivity average has been 1.something%. And to be honest with you, the cases have not been spraying up all over the country. In fact, in very few areas, and the clusters, for example, like the psychiatric hospital, the cluster at the Queen Elizabeth Hospital with the security staff, and we've had a couple family clusters. But we have not had cases even coming out of those clusters all over the country. So at the moment, we are not seeing any widespread cases coming out from any of the situations that we have been dealing with. And for that reason, I would say to you that there is absolutely no reason why we should not have face-to-face classes in Barbados at this time.
Mr. Minister, given that teachers are facing the brunt of the risk at the moment, could you give me an idea, firstly, of how many teachers have been vaccinated at this moment? And also, in terms of island-wide, because you mentioned that there is no widespread spread of the virus, could you give me the number of clusters that we are monitoring right now island-wide as well? So that's a two-part question.
Well, I can't answer the first one in terms of how many teachers have been vaccinated. Maybe we can find that out for you. But the clusters that we are monitoring at the moment, the CMO would have indicated, and we would have spoken to those clusters over the last few press conferences that we've had. But the Queen Elizabeth Hospital cluster, that was one. But I can tell you that those persons who were in quarantine have returned to work. We've had, we're still monitoring the cluster from the northern, the church or church in the north. We have the cluster now at the psychiatric hospital, and there was a family cluster that we referred to that started with, well, one person, and we had 8 persons testing positive on one day, and that cluster probably is about 11 now, and now this new or emerging family cluster that we are following closely. Those are the major ones. Those are the ones we're dealing with at this point in time.
Okay, Carrie Gooding, I have a question. First question for the minister, with regards to the staff at the psychiatric hospital who are refusing to be tested, will there be any repercussions, or what do you have to say to these persons to get them to come forward to be tested?
The testing protocol is very, very simple, and this goes for everyone. If you are deemed by the public health officials to be a primary contact, in other words, that you have had a level of exposure where it is possible that you might contract the virus, and you do not want to take the test, then you have to serve the full 14 days in quarantine. That happens. It has happened with people before who've opted not to be tested, so that in a situation where a person might have been able to spend 5 days in quarantine with a negative test at day 5 or after, and that person would then have been allowed to leave quarantine. If you're not tested, you spend the full 14 days in quarantine.
Mr. Minister, that emerging family cluster that you just referred to, is that in St. Philip? Could you be a little clearer on that, please?
This family cluster is in the St. Michael. I would have spoken, sorry, the emerging one. The emerging one, I am not too sure exactly where, because this one, I know 1 or 2 of them have been in the St. Michael area, but I cannot say with specificity at this point in time that it is all St. Michael, but generally St. Michael.
Okay.
Okay, Minister, one other question. Will any steps be taken in terms of quarantining or testing all the members of this particular family, especially the younger persons, in terms of any other students? So just in case these persons have siblings who are in class 3 or class 4 at another school, will we be thinking about quarantining them?
Their primary contacts, yes. Yes, we have been doing that, as long as they're primary contacts. Remember, for example, the student from the St. George Primary School, that student has not tested positive at this point in time. So there's no requirement, so that you can't speak, for example, to primary contacts because there's no positive case. But the situation at the Princess Margaret, yes, that has definitely been happening.
The psychiatric hospital one minute. Given that some of the persons at the clientele that you're dealing with are persons of diminished mental capacity, is it proven a lot more difficult in terms of protocol adherence? Do you need any additional help? Could you just give me some enlightenment on that, please?
Fair question. The reason why we would have made the decision, for example, to establish an isolation facility at the psychiatric hospital is really for the very reason I know that you're thinking at the moment. And the persons in quarantine at the psychiatric hospital and in isolation are being dealt with by the staff members who are trained and they deal with it on a daily basis. It's their clients. So it is not as difficult as one might have imagined because they are within the facility that is designated and with the trained staff to deal with those persons.
My final question to the Chief Education Officer. Does this in any way set back? I know Akil would have asked something similar, but I want to direct it to the Chief Education Officer. In terms of the goals and for assessment and preparations for external exams and internal exams, you now have one school that has now been, sidelined or has to take a step back even further. How does this hamper that goal of assessment and preparations for the external and common entrance exams, etc.?
Okay, thank you for the question. Good evening, all. Generally, the staff would have met today. The principal would have met with the staff and the students. We know that some students will not be in a frame of mind to continue some of their practical exams, but that is something that we would have to monitor, say, next week. The classes tomorrow will be suspended, and we will be monitoring those students. Remember, they're the exam students for the CXC, so they have the option to defer if they need to do that. So that's something that we will be looking at. The other students at the St. George, they're continuing their classes, so technically we don't think at this time that that should affect them.
Are there any further questions?
Randy Bennett, Barbados today. This question is from Minister Bostic. I was just hoping for an update on the vaccination program. We've been having some issues in terms of mix of dates and people not receiving calls as to when they should return for their second vaccination. So I was just hoping I could get an update on that.
I know that there have been some issues, as you identify, and the coordinating team, they are working on having those issues resolved. And if at times I speak a bit vague in relation to the vaccination program, and in fact I believe the CMO may well be the person to probably answer the question, but I keep having to remind all of us that there's a national coordinating committee that is dealing with the vaccine rollout. And although the Ministry of Health obviously has some oversight, and we support and provide the human resources and the technical knowledge and so on, there is such a committee. Remember, Dr. Ferdinand, who is looking after the immunization part of it, and Major Clark, Defense Force, who's dealing with the logistical part of it. And so sometimes when you ask me those questions, I know because I'm the Minister of Health and Wellness, you probably assume that I deal with those things on a daily basis, but I don't. But I know that the Chief Medical Officer sits on that committee representing the ministry, and I'll ask him if he's able to provide you with any information.
So thank you. We have tried some novel ways to capture a new set of individuals. The Prime Minister had, under her guidance, had indicated that on May 1st, which was the holiday, that we extend test vaccinations to the working class of Barbados in just as a token of appreciation for what they have done. And on that event, we were able to vaccinate more than 300 individuals. This was on the bank holiday. With respect to strengthening our systems, yes, we need to be constantly working on that. We are again looking to reinstitute the mobile team to make sure that individuals who are either disabled or shut-ins will have an ability to acquire either a first dose or a second dose. We have put a system in place where, as we are mainly giving second doses at the moment, we are still giving a few first doses. We have also made a decision that the work at the polyclinic is critical to healthcare in Barbados. This is primary healthcare in Barbados, and therefore we will continue to use satellite stations to coordinate our events. For example, yesterday at the ministry, we had a very, very coordinated and orderly process for second vaccinations. So we are learning from our mistakes and we are moving forward. It is important that persons, when they get their appointments, keep their appointments to the place they have been required to go, because it is absolutely essential that persons come for their second dose. Your best chance of beating the virus and having the appropriate antibodies and immunity is to have a second dose. So if there is one take-home message is that if you have your first dose, find out when your second dose is due. There is an email system and persons have been called up and being advised as to where they can present themselves for their second dose. Thank you.
And at this time, as there are no more questions, let me thank the Minister of Health and Wellness, Lieutenant Colonel the Honorable Jeffrey Bostic, and the Chief Medical Officer, Dr. Kenneth George, for addressing us. We were also joined by the Acting Chief Education Officer, Ms. Joy Adamson, and the President of the Barbados Secondary Teachers Union, Ms. Mary Ann Redmond. Members of the media, thank you as well. And just a reminder that the Minister of Education, Technological and Vocational Training, the Honorable Santia Bradshaw, will speak with members of the media over the weekend. Thank you for joining us. Good afternoon.